Oftentimes, patients do not return to their original injector when they have a complication. I always use an ultrasound to look in this area. It is important to be precise with your dissolving agent and know exactly when you've cleared the area of all the filler. And you cannot do that without an ultrasound or an MRI.
So it's true, we do get a lot of clients coming to us who've come from other injectors with kind of puffiness, water retention, and asking us to fix it and dissolve it. We've done thousands and thousands of cases of dissolving and corrections, and yes, they mentioned that an ultrasound is a useful tool in dissolving, and that's true, but actually the under eye filler tends to be positioned more superficially, so most of the time you can actually see where the water retention is, and an ultrasound just isn't always necessary. Ultrasound is usually more useful if there's deeper placement of the product, for instance in the cheeks or the smile lines, that area, then you can kind of hunt for it using dermal filler mapping through an ultrasound, and even then ultrasound isn't always necessary. The kind of palpation and visibility of the filler is the best way to determine how to dissolve something. And in the under eyes, you often don't want to remove everything. You sometimes just want to take the edge off of it so that it just looks less puffy and a bit flatter. You don't need to remove everything. So it's not a black or white matter. There are shades of grey in between.
My favorite treatment for this to replenish volume is a fat transfer. This is your own filler. It has a color match, a texture match. You also do not have an allergic reaction to your own tissue.
So they're saying that the best solution is a fat transfer. Now, fat transfers are good for some reasons because yes, they do have a color match and a texture match, and they're much, much longer term than dermal fillers. However, permanent solutions have permanent problems. And what happens with fat transfer in some cases, either the fat isn't sitting in the right place, or it can cause what we call dimpling or tethering, which can cause scarring in that area. And it can cause a whole cohort of problems, which then can't be reversed. So yes, dermal fillers have problems associated with them in some cases, depending on the technique and depending on the application, which can be minimized with good experience and good injection technique and good product placement. However, if there are any issues with dermal fillers, they can be reversed and reversed quite easily without implications on the long term. With fat transfer, for instance, if it doesn't go right or it causes issues, it's not reversible unless you do more surgery, so it comes with a much greater risk. So overall, under eye filler can be very useful. Client selection is very important, but more importantly, the right product and the right injection technique, and being very conservative in your approach and having the experience to do that is the most important thing. It doesn't mean that you shouldn't do it, it just means that you need to be cautious how you do it.